So let's talk a little bit about what does depression look like and what's the difference between sadness and depression. Sadness usually lasts for a short amount of time. Depression, though, is consistent and it will last ongoingly for days at a time. The DSM will talk about ongoing days of sadness. I think 2 weeks or longer is significant enough that we can now consider a diagnosis. But there's other signs that are important for us to look at. If the sadness is persistent or a feeling of being empty, and things just seem to be meaningless. There seems to be no reason for our existence. That is a very common sign of depression. Feelings of hopelessness or pessimism. I said that right. Where you just see all that's wrong. You don't notice what is right. And of course, there's always a balance in the world. There's good and there's bad things going on. But if you notice only the bad things, that is probably a sign that you may be struggling with depression. Feelings of guilt and feelings of worthlessness, feeling helpless, these are all signs of depression. The interesting thing is that when you start to feel guilt and worthlessness, you might also notice the fourth sign of depression, which is a loss of interest in things that you used to enjoy doing. Loss of appetite, decreased energy, number 5, decreased energy and fatigue, and are being slowed down. Sometimes depression can look like brain fog. A lot of people are calling the office and saying, hey, I think I've got that COVID brain fog. And they come in and it's not necessarily that. They've got full-blown depression. The other symptoms besides the fogginess are present. So then we go ahead and do Beck's Depression Inventory is a good scale that most clinicians use. But there's really great ways that you can Google self-tests to help you know whether you're depressed or not. Now, difficulty concentrating and remembering is also a strong sign of depression. And it kind of goes with that feeling of confusion and not knowing what to do next. Indecisiveness, is very common with depression. Insomnia, waking up or oversleeping, waking up early or oversleeping. So any change in a sleep cycle may be a sign of depression. Thoughts of death or suicide is very common. And if you've experienced a suicide or death near you or with your family, please be careful to do self-care and notice if you or the people that you love are also beginning to show the signs of depression. Persistent symptoms in the body can also indicate depression. Physical symptoms such as headaches, digestive disorders, or chronic pain. That's right, chronic pain, chronic back pain may actually be affiliated with depression. Some people think that the back pain comes first, which leads to the depression, or the depression leads to back pain or pain in general. They do go hand in hand. So I would look at all of that. Also, if you are depressed, it should not be because you're having a manic or bipolar episode. A lot of individuals with bipolar disorder can have strong symptoms of depression, but then they also go to manic episodes. So it's kind of like a pendulum that swings back and forth. But they're not depressed technically. They're actually bipolar, and the depression is just maybe more prevalent or more obvious. usually manic episodes can look like someone just working all weekend, someone going on a shopping spree, someone overeating. It doesn't always look manic. It may actually be what we call high functioning depression, even, but it can be bipolar and not really a depressive order. Um, I would definitely call your doctor if you're experiencing this or at least three of the symptoms I mentioned. Definitely see a clinician. Make sure that you're talking to a licensed professional. I know there's a lot of great mentors that we have, and the life coaching industry is doing some great things. But when you're talking about depression, it's preferred that you look for someone that has training in psychology and maybe even neurology, because you may have a brain function issue and not just a cognitive issue. So I would definitely go see a doctor if you feel that you have three or more of the symptoms we mentioned earlier. And let me review that again: a feeling of emptiness, life has no meaning, you feel hopelessness, you feel guilty, lack of worthiness, you have loss of interest in your hobbies, you have decreased energy, fatigue, you feel slowed down, you have difficulty concentrating, remembering, you have trouble sleeping or you're sleeping too much, you've lost your appetite, you're gaining weight or losing weight. 10 pounds or more is probably a sign over 3 months. You have thoughts of death or suicide, and you're restless or irritable. And the last one is you have persistent physical symptoms of pain, headache, digestive disorders, or chronic pain. This is your brain coach, hoping that this helps you or helps someone that you love. Please share our information with people. We really want to make sure that one less person decides to take a life, or you take this information and you're more aware and you can help someone. So this is your brain coach saying mental health is wellness. Thank you.